Welcome, ladies and gentlemen. Today we are going to discuss Hodgkin and non-Hodgkin lymphomas morphology. This is a fairly long topic. However, I'll try my best to summarize the morphology as much as possible. Now, I've divided this today's topic into two parts. Part one is about morphology of Hodgkin lymphomas, and part two will be about non-Hodgkin lymphomas. Now, before we move on to the morphology, we need to understand a few differences, which I'm sure you must have read by now. So consider this a revision of your previous knowledge or recently gained knowledge. Um, the basic differences, clinical differences between Hodgkin and non-Hodgkin lymphomas include these, of which you must concentrate on the first one. Hodgkin lymphomas are generally localized to a group of lymph nodes. However, non-Hodgkin lymphomas are generally not localized to a group of nodes. They involve multiple nodes, and another important thing to remember that they have extranodal presentations as well, which are fairly common in comparison to Hodgkin lymphomas. Now, Hodgkin lymphomas, they spread from one group of nodes or one node to another in a orderly fashion. Non-Hodgkin lymphomas generally do not follow this orderly spread. Um, so these are the basic differences. And now we move on to Hodgkin lymphomas. Now remember, Hodgkin lymphomas are generally divided into two: classical Hodgkin and nodal lymphocyte predominant Hodgkin lymphoma. The classical varieties further subdivided into four. So we'll see a few of them one by one. What are the basic differences with respect to morphology? Now, central to the morphology of a Hodgkin lymphoma is this cell. This cell in the center. Now, this cell, which I've just said, that is central to the morphology of Hodgkin lymphoma, is known as the Reed-Sternberg cell or the RS cell. Uh, this is a large cell. You can compare it with the surrounding cells. These are the lymphocytes. This is an eosinophil, and this is a very huge cell in comparison to these cells, in comparison to lymphocytes, plasma cells, and rest of the inflammatory cells. Now, this cell contains two nuclei, so generally they are multinucleated. So this particular one contains two nuclei which have central nucleoli. I'm pointing the nucleus right now. This one is a nucleus, and this one another nucleus. So a multinucleated cell, two nuclei here, which are classically described to be as mirror image of each other. Not necessary in every case, but yes, in many cases they are. Um, this is the nucleus of this nucleus, and you can see the eosinophilic cytoplasm here. Now, generally, Reed-Sternberg cells are surrounded by inflammatory cells, which we have already mentioned: lymphocytes, eosinophils. There may be plasma cells, varies case by case, and according to the morphological subtype of Hodgkin lymphoma. The proportion of the inflammatory cells varies. These cells are not neoplastic. This is the neoplastic cell of Hodgkin lymphoma. Now we move on to another slide. In this slide, what we see in the center is another type of Reed-Sternberg cell, that is mononuclear. So now you know that mononucleated forms are also seen, and there are sometimes forms which are mononucleated but multilobated. But what you can appreciate is that there is again a prominent nucleus present. If we move on to this example, this is from a particular subtype of Hodgkin lymphomas. which is known as nodular sclerosis subtype of Hodgkin lymphoma. These Reed-Sternberg cells in this particular variety are a bit different in the sense, if you concentrate on this cell, this is one lobe of a nucleus, this is another lobe of nucleus, so it has a nucleus that is multilobated, and there is a surrounding space. This is the lacuna. This is the space that is created during the processing. Uh, because of this particular appearance, this is called a lacunar cell, and these lacunar cells are found in nodular sclerosis type of Hodgkin lymphoma. On low power, they show a nodal appearance in a lymph node with acellular bands of collagen, and when a high power examination is done, this is how the Reed-Sternberg cells of this particular type look like. This particular example now we have on our screen, slide number 7, is from not a lymphocyte predominant Hodgkin lymphoma, or nodular lymphocyte predominant Hodgkin lymphoma. You can see here these cells. This is a Reed-Sternberg cell. This is a cell. This is a cell. Now these neoplastic cells in this particular type are known as the popcorn cells. It derives its name from the appearance of the nucleus. This is the nucleus of this cell. Same acidophilic cytoplasm. This is the nucleus of this neoplastic cell, but they have been described to be lookalikes of popcorns. So these have been named as the popcorn cell. Similar surrounding infiltrate for you for an undergraduate level. Remember that the proportion varies, but generally the inflammatory cells surround these lymphoma cells. And these may include varying proportions of lymphocytes, plasma cells, eosinophils, etc. So we have seen different varieties of morphological faces of Hodgkin lymphoma cells, and here you can see another example. Here you can see more eosinophils in the surroundings. You can see here is a Reed-Sternberg cell. This got prominent nucleus. This nucleus, particular nucleus, has got prominent nucleus, and these kind of look like mirror images of each other. So we have discussed different forms of RS cells. It wasn't possible to elaborate much, but these are the basics with respect to Hodgkin lymphoma. Try to remember these. This is the end of part 1. In part 2, we'll talk about non-Hodgkin lymphomas, the more common varieties of non-Hodgkin lymphomas. So, thanks a lot. Signing out for now.